right, welcome everyone. We're just actually first going to stand to salute the flag. Thank you. So good evening. Welcome to the April meeting of the Revere Board of Health. My name is Dr. Drew Bunker. I am the chair of the Board of Health. Joining me for tonight's meetings are two other board members, Dr. Craig Costanza and then Neza Luadi to my left. Attendance for tonight's meeting are the City of Revere staff. It's Lauren Buck, Director of Public Health, Michael Wells, Director of Municipal Inspections, Health Agent, Paula Sepulveda, Board of Health Clerk. Also in attendance is Director of the Six City Tobacco Initiative, Bonnie Carroll, and from the Northeast Massachusetts Mosquito Control, Kelsey Leikos, who's a field technician and communication liaison, Barry Noon, who's the district director, and Kimberly Foss, our entomologist. So tonight's agenda, we were just going to review and approve the minutes from the March 24th meeting. So I'm just going to ask the other board members, everyone approve of those minutes?
I do approve the minutes.
I approve as well.
Great, thank you. All right, next is going to be the Public Health Communicable Monthly Report. Lauren, have you go ahead.
All right, for the interest of time, I'm just going to summarize. The one thing that I want to draw everyone's attention to is that over the last month, we had 114 confirmed cases of flu. This is not unique to Revere. We are over the greater Boston area. There's definitely a huge increase of influenza over the last month. I think we can generally attribute this to masks coming off. So remember, masks protect for COVID and flu. It's affected an 8-month-old to a 92-year-old. We'll continue to watch it. I think the peak is expected to have already passed, but just something to keep an eye out in terms of our flu rates for the year. And I'll just quickly touch on COVID. We have seen a recent increase in our 14-day positivity rate to 4.3 and a slight increase in our 7-day case average to 13.7. Obviously, we keep an eye on this pretty closely. And I think this can really be attributed to the Omicron variant, the BA2 variant that has been around. But so far across the state and in Revere, no real increases in hospitalizations or deaths, which is good. And then I've just provided the latest update on percentage of vaccinations for Revere, which you can review on your own time. Thanks.
Great, thank you. The next thing we're going to talk about is the smoking regulations, and I'm going to have Michael go ahead and Michael Wells talk. Or wait, are we starting with? Okay.
Yeah, we're going to have Bonnie, if she could open it up for just the review of the law. And introduce the suspension.
Sorry?
In introducing the suspension rules.
Okay, yes. So my name is Bonnie Carroll. I'm the director of the Six City Tobacco Initiative. One of the cities is Revere in that Six City Collaborative. And my job consists of 3 parts. One is to do education of retailers around smoking regulations, also to help boards of health change their regulations to make them more reflective of what we see in the field as to what young people are being involved with and young people are buying in the stores. And the third one is to do enforcement. And that means to follow the laws closely and consult with the attorneys who advise us in the program. It's part of a grant-funded position under the Mass Tobacco Cessation Program. And so recently I did compliance checks, in Revere, using a 17-year-old boy, a 17-year-old girl, I apologize, and a 16-year-old boy. And there were several violations that were found at that time where the young person, particularly the boy, was not asked for any identification or asked his age. He was just handed the product. And the way that we can be sure that that these are fair compliance checks is that I wait in the car, I send in the young person who's a trained young person. They know what to say. They know that they're not allowed to lie. They have to say their accurate age if they're asked. They have to say they don't have an ID if they're asked for that. And they just ask for the product that I tell them to ask for. Before they go in, I take a picture of them. I make sure that they don't have anything in their pockets, so they don't have their own money. They don't have any cigarettes or anything like that that somebody could construe that the store was planted with something. And they come directly back to the store after the compliance check, whether they were sold something or they weren't. And when they come back to the car, I immediately enter it into a database. And so we enter what the young person asked for, we enter their ID number, which I have. We enter a picture, I have a picture of them on my phone in case that ever comes up. And I enter what products they bought, how much it cost, and if they were asked for an ID or if they were asked their age. So during these inspections recently, I issued, I think it was 8 what we call cease and desist orders. And the most significant thing about the cease and desist orders, which are new since a new law passed in during COVID in 2021, and this was called an Act to Modernize Tobacco Control. Up until that law passed, we had always issued what we called 21D, or Revere, I think, called 40U tickets. And the highest rate you could go on those tickets was $300. Most retailers had gotten used to that. That was kind of the protocol. But now, underneath this new law, the state has decided what the fines will be. And the first fine for sale to a minor for the first time is $1,000 and a suspension of between 1 and 30 days. And I believe it came before you already to decide on the amount of days that you would pick during this, for the suspension.
No, Bonnie, we're going to vote on that now.
Oh, you're going to vote on that now? Okay. Well, we recommend that you do 3 days, which is what the rest of the collaborative, or most of the collaborative has done. So we always recommend that cities follow the, the kind of the, stay together with the collaborative. So we recommend that it's a 3-day suspension. If the person in the store violates a second time, it's a $2,000 fine and a mandatory 7-day suspension. The third violation is a $5,000 fine with a 30-day suspension. So that first suspension can be anything you want it to be, between 1 and 30 days, or even you could go higher if you wanted to, but we do recommend 3 days. So, and any questions you want to ask, or anything else you want me to talk about?
I think you've covered it, Bonnie. Thank you. We'd like to take a vote of the board in support of the 3-day suspension for the first offense.
Yeah, I'm going to go ahead and agree with the 3-day suspension, I think, following the other cities' boards of health.
Mm-hmm. Okay.
I do agree as well for the 3 days and $1,000 fine for the first offense.
Mm-hmm.
And I'll approve too for 3 days.
Okay. Okay. Is that the,
Yep,
okay.
approved.
So the next step is that I believe there are 2 retailers who wish to appeal their fines and suspensions. I'm not sure if they're here tonight, but they said that they were coming tonight. And so because of that, I brought the evidence with me, only for those 2 stores. So I apologize for that. I should have brought the evidence for all the stores, but 2 people were the ones who called and said they were coming. So this is for Bada Bing Market, and this is for Gasco. These are the products that were
Thanks.
purchased.
I got it. I'll try to negotiate it.
Sorry? That was something not involved with this? Okay. So I just wanted to say that, that the Board of Health's responsibility under the new tobacco law is to uphold the state's decision on this and to not lower the fine or lower the amount of suspensions, days of suspension that you decide upon. So that would mean that the retailer, if the retailer can provide evidence that a protocol was not done correctly by me or my staff, then there would be a case for negotiating the lowering of the fine or the suspension. But unless that is the case, which I don't think it is in these circumstances, then the board is sort of charged by the state to uphold that the cease and desist order with that amount of a fine and those days of suspension. Okay? Okay. If you have any other questions, I can answer them. Or, no.
Thank you, Bonnie.
Okay, thank you.
Thank you.
A little
Thank you.
background in regards to the City of Rivere's tobacco control program. As Bonnie mentioned, it is managed by the Six City Initiative, which is managed by Bonnie Carroll out of the city of Somerville. These communities in the collaboratives are Somerville, Cambridge, Chelsea, Everett, Winthrop, and us here in Revere. Inspectional Services is responsible for the licensing of the tobacco businesses. The Six City Initiative is responsible for the enforcement of the state and local regulations, as Bonnie mentioned, and the City of Revere maintains a total of 60 tobacco licenses, which was voted on by the Board of Health. So on Sunday, March 27th, compliance checks were conducted at various Revere businesses. As Bonnie mentioned, a 16 and 17-year-old male and female were sent into the businesses to purchase tobacco products. 8 Revere businesses sold products to underage individuals. Under Mass General Law, Chapter 270, Section 6, failure to check identification of purchaser under 105 CMR 665.020. The first violation, as Bonnie mentioned, is a $1,000 fine and a suspension of 3 days, which was just voted on by our board. Those 3 days will be May 9th, 10th, and 11th, which is a Monday, Tuesday, and Wednesday. The businesses found in violation were Shirley Ave Variety, located at 65 Shirley Ave, Oak Island Variety, 831 North Shore Road, Convenience Mart, located at 270 Broadway, Gasco, located at 520 Broadway, Badimbong Market, located at 120 Shirley Ave, ABC, located at 170 Revere Street, Anthony's Supermarket, located at 760 Broadway, and Joe's Quick Mart, located at 41 Lee Burbank Highway. The 2 businesses that wish to appear were Gasco and Badimbang. If any of those representatives of those businesses would like to come up to the podium and appeal your case.
Hi, good evening. My name is Peter. I'm presenting Gasco. I had spoke with my guy who sold the cigarette to the person. My guy said that he asked the person for an ID, and the guy claimed that he doesn't have his ID on him, but he's been in the store before and he's been checked for ID before. That's why he sold it. And if we look at my record, since 2004, I've been in this business. I never get in trouble for selling tobacco to a minor. And thank you.
Since the new law passed, we have decided at the state level to consider everyone's sale to a minor their first offense because it's under this new law, and we feel like it would be fair for people to have the chance to get used to this. But that Gasco has sold before in 2019. Even if he hadn't, though, we would be starting with 3 years, a 36-month suspension. A 36 months, you have to have sold more than once within a 36 months period. So yes, that period is over, but it isn't the first time. And the second issue that I'd like to address is that the young people, obviously I'm not in the store with them, so I can't be sure of what they say, but I do know that they are well trained. They know what they are supposed to say. They are supposed to say, if they're asked for an ID, I don't have it. That's what they say. If they're asked for an age, they have to say, I'm 17. And just to add to that, and so that the retailers hear this as well, we've been doing a lot of education since this new law passed, and there's something that the lawyers who work with us are calling the Fenway Rule. And what that means is that if you go to Fenway Park and you go to buy a beer, they ask you for an ID, no matter how old. If you look like me, they ask you for an ID. And when you go back to your seat and drink that beer and come up 10 minutes later, you get asked for an ID again. That's to ensure that they're never selling to an underage minor. And so since this new law passed, we've been educating retailers to understand that the law now says they have the same responsibility as that Fenway Rule. They are to be identifying everyone's ID. So even if it's a person who is known to the store, basically they should be asking for an ID, and that would prevent this kind of thing from happening. Okay?
Just a point of information as well, when this new law passed back in 2020, I think it was, Bonnie? Bonnie had sent all this information over to us, and she had been in contact with all of the tobacco establishments in the city. And as well as that happening, our inspector went around, we printed off all of the documents that Bonnie sent over us, including all of the new signage that needed to be posted and the new laws. They were all hand-delivered to every established, all 60 tobacco establishments at that time. Is there a representative from Baden-Bain?
Hi. Would like to...
Sir, your name and address for the record, please?
Yeah, my name is Mong Kyle, and I'm come from Bad Bong Market. And would like to ask for forgiveness. Yeah, because for my first time, I judged to the person wrong. Yeah, he looked like, I think he looked like over 21. Yeah, to me. So I'm sorry about that.
I think it's obviously a very hefty fine, and we don't want anyone to have to pay that or have to deal with that, or even the 3 days of suspending the tobacco license. But we are forced by the law in terms of the fine, and it's frustrating because obviously we understand you all business owners. It's a difficult time, and we wouldn't put this on anyone. But I don't think, my worry is that if we don't follow this law, that then we get in trouble, particularly from, the district attorney's office, and we have to, in some way, protect our own selves to follow the law. And I know I apologize that you are forced to have to pay this fine, and I think that the whole circumstance is challenging because at the same time you want to believe what someone's saying, and but we have to unfortunately enforce the law from our perspective.
Can I say something real quick? I want to provide some context as to the why that these laws exist and feel so punitive. It's the whole goal, speaking as the nurse in the room, I just want to say from a healthcare perspective, the rationale behind having such punitive and harsh laws is because we want to prevent children, youth, from picking up smoking because we know how harmful that is. There is a statistic from the American Lung Association that says that every day, almost 2,500 children under 18, which these two representatives were under 18, try their first cigarette, and more than 400 of them will become new regular daily smokers. Half of them will die from smoking. That's the why behind these sometimes punitive feeling laws.
Okay, thank you.
Would anyone else like an opportunity?
Okay, good evening, everybody. Khalil Koudri, representing Just Quick Mart in Revere. I'm tall a little bit. Yeah, my name is Khalil Koudri. I'm representing Just Quick Mart in Revere. Yeah, so I have just a question. If that young boy was asked about, like, to provide the date of birth. Yeah. Yeah, it's fine. So I said, if that little boy was asked to provide like a date of birth and send it, so that's gonna be a fine? That's a violation, I mean?
If he was told, if he told his date of birth to, oh, I'm sorry. If he told his date of birth to the clerk, yes, it would still result in a fine because his date of birth would be underage. You know, so the clerk would need to figure that out. But that's not what we tell them to do. We tell them to say their age and, you know, and say that they don't have an ID.
Yeah, because on my case, and they have like a recording video from that store, so the little boy walked in and they asked him about ID, and he went back to the car, and they believe that you were in the parking lot. So after he came back, so you can see in the video that she asked him again, and he provides something, and it's in the receipt that he said like 1995,
Oh, I'd
August
love to see
31st.
it, because if that is the
Yeah,
case,
I got him.
then he is not
Yeah.
doing what he's supposed to do.
So this is from that day.
Is this okay?
Is that okay?
Yeah?
It's fine?
This is fine, yeah. I think this is important information.
Uh-huh. Which store are you from, sir?
Joe's Quick Mart and 41
Okay.
Labor Bank Highway. Yeah. That's when
Yes,
he
that's
came
him.
in. Yeah, that's him, yeah. And this is I just print this one here for you, because I know it's gonna be really hard.
Uh-huh.
It shows the receipt, because in every video it says like, that's the date you provide. August 31st, 1995, and he bought a Joe, right? Joe
Uh-huh,
Bats?
yes.
Yeah,
Okay,
and you can see that they sent him back first.
yes.
So you show that,
But-
right, ma'am? That's the guy, right?
Yep, that's
So
the
he
guy.
came in,
Uh-huh.
so he asked for cigarettes, they asked him for ID, he went back to the car,
Uh-huh,
right? He sent him back. So he's gonna come back again.
uh-huh.
And at the time, when he's gonna told her that I was born August 31st, 1995, and she typed it in, and you can see it in the receipt.
Yeah, but you can see that 1995, right?
1995, that's not 17 years, man.
Can somebody do the math for me? I'm too.
1995,
Yes.
then he'd be 27, 27 years old.
So she typed in this.
Yes, that's
Do
the
you
one.
have, do you have audio on here?
Oh, no, we don't have.
Ah, I
But you
don't,
can see like, so the
Yeah,
first video,
that is
so we
him.
showed-
Mhm,
yeah.
that is
So
him.
they sent him back to the car, right?
yeah,
Yeah.
because he said he didn't have an ID?
Yes, they asked him about ID, and he said, I don't have them, so he went back. The time he came in,
Bon-
so you can see.
Bonnie, do you mind, is this something that can be discussed after the meeting?
Yes.
Individually?
And if that, yes, if that is the date that he provided,
Yeah.
then that is a protocol error.
Okay.
And I would say that,
Okay.
that you have the right to deal with that as a protocol error.
Bonnie, are they required to show a picture ID?
No, they cannot show a picture ID, so.
No, I know, but if they were asked, if he was old enough and had an ID, he would have to provide that picture ID?
Yes, he should be providing a picture ID.
So the store should not be taking anybody's word
Good point, yes, yes,
on that, whether he's 27 or 17.
right, that's right. And actually, the boy is 16, so it was the girl that was 17, just as, but, yeah, if he said, you know, August 31st, 1995, he certainly shouldn't have said that. But you're right, he still should have been asked for an ID, yeah, okay.
Thank you, Khalid. So to close out this portion of the meeting, it stands that it appears that the appeals have been denied at this point. due to no administrative errors being performed during the compliance checks, and with no wiggle room from the state's standpoint of the fining process and the board voting on the 3-day suspension.
Yes, I'm just going to agree with that. I think we have to follow the law. I understand the frustration a lot of businesses have and the feeling that, you know, they did their best to try to identify that the person was, or did their best to give the product to who they thought was someone over 18, but you need to follow the law, which is to look at the ID and confirm it. So I think we're forced to follow the law. Everyone else on the board agree?
I agree.
Yeah, I agree. Sure.
Next item on the agenda?
Yeah, so it looks like it's about the heating variance.
Thank you, Dr. Bunker. Tonight before us, we have a vote on 3 heating variances. And I just going to give you a little background of what a heating variance is. So under the state sanitary code, condos and apartment buildings can turn off their heating systems from June 15th to September 15th. Heat must be provided prior and after those dates mentioned. The Board of Health on, On November 7th of 2017, the Board of Health approved new regulations for heating variances, allowing these particular condo and apartment complexes to have a variance in their heat from May 31st to October 1st. Some of them have come before the Board of Health asking for an extended variance from May 15th to October 15th. The buildings that we are speaking of are buildings located typically on Revere Beach Boulevard and Ocean Avenue. This comes before us pretty much every year as we head into the summer season, and they're looking to be able to, you know, switch off their heat and turn on their air condition. The buildings with this situation are buildings that were built in the mid-'80s, early '90s, and they have one unit that controls the entire building. So there's a process to shut off the system and switch it over from heat to air condition. The buildings on Revere Beach Boulevard obviously get the sun all day long. They're, you know, high rises. The heat rises within those buildings, causing the temperatures in those buildings to climb throughout the day. Particularly in the spring, where if we have a normally mild spring, where it's warm out and, you know, those temperatures in the building are climbing. So they ask for relief to be able to do this. The 3 that we have before us tonight are the St. George condominiums located at 350 Revere Beach Boulevard, the Breakers condominiums located at 474 Revere Beach Boulevard, and Ocean Gate condominiums located at 382 Ocean Avenue. St. George and the Breakers do ask for an extended heating variance, which includes May 15th to October 15th. Ocean Gate condominium is at a regular variance from May 31st to October 1st. Do we have a vote from the board on the approval of these variances?
Yeah, so I'm going to go ahead and approve based on the fact that those dates seem adequate in terms of when heat would need to be turned on. So I'm going to approve from my perspective. I don't know if anyone else on the board can.
I approve as well.
Yeah, I approve as well the variant.
To be clear in the variance, the condo association has to provide a 51% vote from the owners of the building of those units to be able to have that variance granted to them.
Okay. So they obviously have to vote on their end, not just us. Got it. All right, so I think we have a 3 for 3 from the board on this.
So the heating variances have been approved.
Great, thanks, everyone. So the next item is the Northeast Mosquito Control, who is on Zoom. Kelsey, Barry, and Kimberly are on Zoom. Thanks for being patient with us. 6:30, and we're turning over the meeting for their presentation.
Okay, can you hear me?
Yes.
Okay, let me share screen. Okay. And I just want to make sure Kelsey is also unmuted. She'll be co-hosting with me.
Yep, all set.
Co-presenting. Okay, thank you. Okay, good evening. I'm Kimberly Foss, entomologist, and joining me is Kelsey Liaco. She's the Board of Health liaison, and Barry Noon, our district director, is also on the line. And we're from the Northeast Massachusetts Mosquito Control District. We would like to thank the Revere Board of Health for inviting us tonight to present our district policies and operations. We can answer all your questions at the end of the presentation. We will also quickly summarize the 2022 Best Management Practice Plan for Revere. Right, I'm trying to, sorry. Our district integrated mosquito management program is based on mosquito identification and surveillance and monitoring, use of prevention strategies, and action and treatment thresholds. We accomplish this by maintaining mosquito population levels below those causing significant human illness. A key IPM principle is that selected pesticides should result in the lowest possible risk to health, property, and the environment. To minimize the impact of mosquitoes on human health, we incorporate education, surveillance, source reduction, habitat manipulation, biological controls, and targeted insecticides in our IPM program.
We recently redesigned our website to be more user-friendly to residents. The homepage buttons are focused on services provided to the residents, such as residential ULV spray and property inspection requests, spray exclusion, which we'll touch more on later, pesticides, which provides a detailed list of the pesticides we use, their labels, and safety data sheets, FAQs, providing questions and answers on everything from catch basin larviciding to salt marsh helicopter treatment. Protect Yourself offers information to residents on how they can prevent mosquito bites and breeding on their property. And lastly, Notify Me, an option for residents to subscribe to topics of interest as they're shared on our website and other social media platforms such as Facebook and YouTube. We still have our municipal toolbox. The login is located on the top right corner of the screen. Boards of Health may sign in for information relevant to them in a mainstream format, helping you find what you're looking for that much faster. The website is also mobile device friendly, making it easier for residents to utilize this resource right from their smartphone or tablet. Part of our education and outreach follows the state's messaging on preventing mosquito bites by reducing mosquito breeding around your home and the use of personal protection while outdoors. We encourage residents to use CDC-approved repellent to reduce the risk of both mosquito and tick bites, and to wear protective clothing or stay indoors when mosquitoes are most active. They should also mosquito-proof their home by dumping any standing water that is present for more than 5 days, like regularly cleaning bird baths, clogged gutters, emptying pet dishes, and unused swimming pools. Make sure all screens are repaired and trash, recycle bins, tarps, and boats are turned upside down so they don't collect water. Residents or boards of health may call us for property and site inspections if there are wet areas on lawns, unused swimming pools, ditches, or wetlands that have been breeding mosquitoes. We can treat using a larvicide. Boards of health can also call us to inspect unsanitary or vacant properties for mosquito breeding. We will also remove abandoned tires upon request. Upon completion of requested property inspection, our field technicians will leave a door knocker notifying the resident. When the boards of health request this service, NMMC will provide a detailed email regarding the state of the property, including an inspection assessment.
Surveillance is the cornerstone of a quality integrated mosquito management program. Surveillance provides data to support timely and effective control actions to reduce mosquito populations and the risk of mosquito-borne disease. Larval surveillance allows us to identify and treat breeding sites, often eliminating the problem before adult mosquitoes appear, and is a critical factor to determine how to control mosquitoes and the potential disease risk in a community. Adult mosquito surveillance season begins the second week of May and continues weekly until the end of September. Each municipality has several different trap types collected each week, usually on Mondays and Tuesdays. Specimens will be sent to the public health lab for testing starting June 1st. In the beginning of the season, we will only send bird-biting mosquitoes to determine if West Nile or Tripoli is circulating in the bird population. Once any community in Massachusetts gets a positive virus notification, all mosquito control districts start submitting bridge vector mosquitoes. These are species that feed on both mammals and birds, transmitting the virus from infected birds to humans and other animals such as horses. The public health lab releases positive results on Thursdays by noon. We then contact the local board of health and coordinate the appropriate response. In years where virus is extremely active and weather conditions are suitable for response, the Department of Health may extend the surveillance and virus testing season into October. Most of our traps are designed to capture adult mosquitoes. The CDC CO2 light trap uses carbon dioxide, octanol, and light as attractants. These traps are mainly used for virus testing of bridge vectors, which are mosquitoes that can transmit virus from birds to humans. Traps are placed in historic locations to monitor mosquitoes over long periods of time. These same traps are also used as mobile deployed supplementals for virus response and can be used in pesticide efficacy studies. Gravid traps are designed to collect mosquitoes that bite birds. These mosquitoes are the primary vector species in the bird-to-bird West Nile virus cycle, and these mosquitoes are also tested at the beginning of the season. These traps contain a water and hay infusion as an attractant to lure the females to lay eggs. These females are gravid, which means they have blood fed and contain eggs for laying. Once a mosquito is fed on infected birds, West Nile virus can then be detected in mosquitoes sent to the lab for testing. Supplemental traps are deployed after the first West Nile or Tripoli detection in any municipality and continually used for virus notifications after July. These are the same design CDC CO2 light traps I discussed earlier. Those additional mosquitoes that are collected from the supplementals are identified and sent for testing with the current weekly batches. Supplemental traps are also used for pre and post monitoring of adulticide efficacy in areas with heavy mosquito complaints to determine what species are on the wing. For equipment security and resident privacy, we do not disclose the locations of any of our traps to the public. Local boards of health can request this confidential information. Each year, the district clears over 20,000 feet of impacted stormwater ditches and 50 culverts. This allows the stormwater to flow without blockages, creating stagnant areas where mosquitoes can breed. Large salt marsh restoration projects provide deeper pools for birds and fish, while ditch restoration allows for drainage of tidal water from upper salt marsh areas where the mosquitoes breed. We remove approximately 700 tires each year through wetland projects, coordinated cleanups, resident requests, and hazardous waste events. The mowing of Phragmites is done to allow easier access to the breeding sites of the mosquitoes.
Larviciding is the primary chemical approach to mosquito control. It is much more efficient to reduce the mosquito populations when they are larvae in the water rather than flying adults. Spring freshwater sites and abandoned swimming pools only require one treatment per year, while salt marsh summer floodwater sites and ditches may require multiple treatments throughout the summer months. Our catch basin program is designed to reduce the seasonal risk of West Nile virus in urban areas. Treatment begins in late May, early June, when the water temperature in the basins reaches 70 degrees. Annual treatments can have a cumulative effect in reducing the total population into the following year by up to 80%. Municipal DPWs can assist the district in efficient treatments of basins by scheduling annual cleanings before the end of May or after August.
Since mosquitoes are easier to control when they are larvae, We have a wide variety of proactive larvicide products at our disposal. All of our products are registered with the EPA as Category 4, which are low to very low toxicity and the lowest category accepted by the EPA. All larvicides target species specific at a particular stage of development in a certain habitat and at different times each year. The larvicide products we use are not known to develop resistance in mosquitoes. They are packaged in either a liquid or granular form, and efficacy can be up to 85% or more. We primarily use bacterial larvicides containing bacillus strains for control of mosquito larvae in salt marsh, freshwater, and clean catch basins. The bacteria are naturally occurring in soil and affect only mosquito larvae. The larvae feed on the bacterium, and the toxins that are created kills the larvae. These bacterial larvicides are not toxic to people, pets, other animals, aquatic life, or other insects, including honeybees. They can be applied safely to standing water without causing harm to food crops or water supplies. For long-term control of mosquito larvae in man-made containers, swimming pools, and grass and leaf-filled catch basins, we use methoprene. Methoprene is an insect growth regulator that prevents normal development from the immature phase to the adult phase of the mosquito. Methoprene is a very low toxicity to humans and other invertebrates. Larvicide products are continually being produced with both increased efficacy and environmental consciousness. All our larvicide products are precisely targeted for mosquitoes. Labels are followed, applied by highly trained technicians, and careful consideration for each application is taken.
The district deploys ultra-low volume, or ULV, truck-based adulticiding only when coordinated with the local boards of health for virus response or when residents are allowed to call in a request. Zenovex E4 is the active ingredient and only used at night, 30 minutes after sunset, to protect bees and other pollinators. There is no residual to the product, so it does not stay in the environment to keep working. It only knocks down flying mosquitoes at the time of application. A barrier treatment is applied to public areas such as schools, playgrounds, parks, and athletic fields. The treatment is a residual and is applied to a physical border like trees, fences, or outdoor structures. Following our phased response to virus protocol to reduce the risk of West Nile virus and EEE human infections, the district may recommend selective and targeted adulticiding applications when virus-infected mosquitoes are discovered. Only boards of health and our subscribing member communities can request adulticiding and barrier treatments for schools, recreational areas, and publicly owned municipal property. Barrier treatments are not required for every town, but is a helpful preventative measure to consider in communities that have high-risk mosquito virus history and expect lots of outdoor recreation during peak mosquito times. Barrier treatments should be scheduled early and prior to human virus transmission season, with treatments scheduled for late July into August. Depending on when the request is made by Board of Health, either suspend SC or suspend polyzone is used. Again, this treatment is applied 30 minutes after sunset to protect bees and other pollinators. This year, district best management plans included a new checklist to guide boards of health for tasks that can be completed early in the season, such as scheduling barrier treatments and contacting IPM coordinators to update school IPM plans. In communities that adulticide for virus only, district virus response protocols must be met to be recommended for a block virus response. These protocols have also been included in the BMPs for 2022. Boards of health can request adulticiding through the municipal toolbox on our website or by email. Many coordinated virus response treatments may be scheduled over the phone, and a follow-up email will be sent to confirm the time, date, location, and backup date, so public notification can be completed prior to the treatment. Confirmation of completion will be provided. Salt marsh mosquitoes can be extremely problematic for residents outdoors during the daytime as they are day biters. They rest in damp, thick, overgrown areas of vegetation at night, and our nighttime applications will not control these mosquitoes very well. Use of repellents and proper clothing or staying indoors is highly recommended when salt marsh mosquitoes are bothersome during the day. Coastal municipalities are encouraged to keep vegetation in public areas maintained. Schools may find it necessary to have their property treated to increase protection from mosquitoes. This can include catch basin treatments, larviciding, adulticiding, and barrier treatments. The school IPM program is in accordance with the Children and Families Protection Act, which requires a school's IPM plan to list the pesticides that they are going to be applied on school grounds. Schools must include mosquito control in their outdoor IPM plans if they intend to request mosquito control services on the property. You can view all the public and private school IPM plans on the Mass NRC website to check if they are updated. As a reminder, school outdoor IPM plans should be up to date with our current products when considering any treatment on school grounds. It is the responsibility of the school districts to create and maintain an IPM plan for their school. We encourage boards of health to follow up with IPM coordinators for schools in their municipality to ensure they are receiving the proper mosquito control treatments. If IPM plans don't list the products we use, we cannot treat the property. Every spring, we email the product lineup to the IPM coordinators and boards of health, and we can assist in the addition of products to the plan. The Mass NRC website has a help desk available for assistance. Some municipalities allow residents to request adulticiding for their individual property. These requests are made through our website, and residents will receive confirmation upon completion or cancellation of the application. We use ULV truck-based treatment applications. Our vehicles are NEMMC marked white trucks and will be driving slowly through the requested areas. Residents and pets should remain indoors while the vehicle is operating in these designated areas. Air conditioners can remain on. We ask that doors and windows street side are closed. These can reopen and normal outdoor activities can resume a half hour after the truck passes. We will mention this again. Salt marsh mosquitoes can be extremely bothersome for residents outdoors during the daytime. They fly and bite during the day. Our nighttime applications will not control these mosquitoes very well. Use of repellents and proper clothing or staying indoors is highly recommended when salt marsh mosquitoes are bothersome during the day. Residents are encouraged to keep lawns mowed, yard and lawn vegetation maintained, and dump water-filled containers. Residents who request exclusion of their property must comply with the legal process to do so. Private property owners may request exclusion from wide area applications of pesticides on their property by the district. If a tenant is requesting the exclusion, the landlord contact information must be included, and the landlord can override this request. Each property owned needs its own separate exclusion form to be filled out. Exclusions cannot be completed for publicly owned property. This procedure excludes the entire property from adulticiding and larviciding if the area to be larvicided is 1 acre or more. What areas under an acre may pose a public health nuisance and larviciding can be completed. Requests must be made to the Massachusetts Department of Agricultural Resources and will go into effect 14 days from the date the request is received. All exclusion requests starting on January 1st and expire on December 31st of the calendar year in which it was made. The exclusion request may be accessed from either our district's website or directly from the MDAR website. Exclusions may be waived in a public health emergency by the governor or by the state public health department. We receive the property exclusions from MDAR. When we receive the exclusion, the parcel goes into our GIS mapping system, and technicians automatically receive a systems warning when approaching the excluded property boundaries.
Many people ask what we do for the rest of the year when we're not treating mosquitoes. We do mosquito control year-round, and most of the wetland, tire, and ditch maintenance projects are completed during the winter months. Here is a seasonal breakdown of all our operation activities conducted by the district. And I'll finish with a quick summary of last season in Revere. The district received above average precipitation in 2021, resulting in an abundance of fresh floodwater and salt marsh mosquitoes. We sent 18 mosquito batches from Revere last year to the public health lab for testing. No West Nile virus or Triple E mosquitoes were identified. The last West Nile virus event in Revere was during 2020. Revere was raised to moderate for West Nile last year due to the proximity of West Nile events in the Boston area. We received 12 residential property inspection service requests, which was up from 6 in 2020. No residents filed pesticide exclusions. We did receive 526 residential adulticide requests, which was up from 351 in 2020, and 608 Board of Health adulticide requests, which was up from 73 in 2020. We completed treatments in 3,102 catch basins, was completed on June 27, and we regularly checked 18 larval breeding sites through the season and treated with larvicides as needed. We also completed almost 42 acres of Phragmites mowing in multiple locations. We've made a few important additions to the best management plan for Revere for the 2022 season. Again, the Board of Health checklist has been added on page 3. This is proactive and helps prioritize and schedule important district seasonal activities for your community before a EEE or West Nile virus event occurs. This includes updating school IPM plans to have all our pesticide products listed. By adding this feature to our BMP, we can complete preventative barrier treatments before school enters fall session when EEE and West Nile are most active for human transmission, and scheduling emergency treatments and access may be more difficult. We also added a bulleted arboviral response protocol on page 4. This protocol is a quick resource tool that follows our lengthier integrated pest and vector management plan we emailed out earlier this year. It provides DPH, the Department of Public Health, scenarios for common situations we encounter during virus season and how we will be coordinating response tactics with your local boards of health for each situation. So far this year in Revere, we have inspected 4 mosquito larval habitats and treated several sites breeding early snowmelt spring and salt marsh mosquitoes. We did receive 2 resident request property inspections to date. And does the board have any questions for us today?
So are you guys doing any adulticide just on, is there a plan for that just generally in Revere? To just do it general to areas that are of concern?
Let me, if you unmute Barry, he can answer that question for you.
Hi, guys. Can you hear me? Hello?
Yes.
Yeah, we can hear you.
Yes. Okay, great. So we don't start adulticiding until June 1st in the district, and Revere residents are allowed to call to get their property sprayed as of June 1st until around September 30th. We wouldn't be doing town-wide spraying or target spraying for the city unless there was virus detected. But as of right now, residents can request our service as of June 1st.
Thank you for that clarification. Sorry.
Okay.
I don't have any more questions.
I don't have any questions. Thank you so much for all the information. That was very interesting.
And again, if you have any questions in the future, please feel free to email either Barry, I, or Kelsey. Kelsey can answer most of the questions. She is the Board of Health liaison. And we'd like to thank you for having us come tonight.
Thank you.
Thanks, guys. As always, really informative presentation.
Thank you.
And thank you.
All right. So I think that's,
Okay, one more
is there one
item
more thing?
agenda. Yeah.
Of course,
Okay.
yep.
Sorry, this is the last thing on the agenda. It was a busy night tonight. Last month, we started bringing forth any Board of Health licensing applications that we had processed within the last month. We are continuing that this month, and we'll continue it for, the next couple of months while we process through all of the licensure that, somewhat got put on the back burner during COVID, but now we're catching up. So today, we have one body art license. Sorry. We actually have 2 body art licenses for you to discuss. They are both for a microblading salon on 50 Revere Street. The owner of the salon is Maria Camilla Nieto. She owns Brows by Camilla. She is a microblade, so she is a sole practitioner in her establishment, but each establishment has to apply for an establishment license, and every practitioner needs a practitioner license. Therefore, tonight, we are asking you to review and hopefully approve both her establishment and practitioner license. She submitted her application via CitizenServe on April 11th and April 13th. We did her inspection this morning. She passed the inspection from the Inspectional and Public Health Department lens, and we are recommending that you approve both licenses for both the establishment and the practitioner license. That's it.
I approve.
Yeah, I approve both licenses.
I approve as well. All right, I think that is it. Okay, all right. Thank you all, and that is the meeting.
Motion to adjourn?
Second.